Well, joining us live for Medical Monday tonight, Dr. Steve Zent, an oral surgeon from BayCare Clinic, talking about wisdom teeth 101 today. Now, this is something that affects a lot of people, so we should talk first, like, what are your wisdom teeth and why are they need to be removed often?
Well, the wisdom teeth are the last teeth in the mouth that develop, anywhere between the ages of 14 to 24. The reason they're such a topic of the discussion, they have a high percentage rate of developing complications.
Okay.
And it's those complications that makes it mandatory that we take them out.
Okay, so when they are removed, what are the benefits from your mouth? Like, what are you avoiding
Well,
there?
the big issue is some of the complications you can have is anything from infection, cavities, gum disease. There's a lot of link to some systemic conditions as well.
Okay.
There's even tumors and cysts that can develop in wisdom teeth that are retained.
Wow, lots of problems. Yeah. All right, so if you don't have any problems with your teeth, your wisdom teeth don't affect you, maybe they really haven't even come up to the surface at all, could you still need to have them removed?
Very common question. The big difference is understanding the difference between symptom-free and disease-free.
Okay.
If they're truly problematic or non-problematic and disease-free, they can be maintained just like any other tooth, exams, x-rays. However, an oral surgeon should be involved and help you decide which ones are more likely to cause problems down the road. We're very good at predicting who's going to have troubles with them based on evidence and data.
Okay, excellent. So a lot of people do end up having them removed. I had mine taken out when I was 17 years old. So what can people really expect for this procedure and how invasive is it?
Well, mostly the patients will answer that question by saying it's a lot less intimidating, it's a lot more gentle, and it's just not as much drama as they were expecting.
Oh, good.
The process itself is different for each patient, of course, but the earlier in general you get them out, the more comfortable the whole process is, the easier the recovery is.
And what happens after they're pulled out? What's the recovery process like? Because you've got holes in your mouth, essentially.
Yes. The recovery part, the biggest portion of that is the first 3 to 4 days. We just ask you to maintain a low level of activity. You can move around the house and do normal activities, but low level, you generally have a prescription for pain medicine to help manage that if it's indicated. Soft diet, maybe a little soreness and stiffness, but nothing too dramatic.
And what's that recovery look like? A week or
3 to 4 days.
3 to 4 days. Oh, that's all. That's not bad.
No, you shouldn't run a marathon or do a triathlon within about a week or so, but 3 to 4 days is the biggest part of it.
So in general, you do recommend that people have those teeth taken out?
Statistically, yes.
Okay, but definitely on a case-to-case basis, looking
Correct.
at those teeth. All right, thank you so much, Dr. Steve Zent, for joining us. And for more information on wisdom teeth, just head over to our website, NBC26.com.